NCLEX Certification Exam 2026. Question 1. A client with increased intracranial pressure is being monitored. Which finding requires immediate intervention? Option A, pupils equal and reactive. Option B, systolic blood pressure 150 mm of mercury. Option C, respiratory rate 10 breaths per minute. Option D, a Glasgow Coma Scale score decreases from 14 to 10. The correct answer is option D. Glasgow Coma Scale score decreases from 14 to 10. A decreasing Glasgow Coma Scale score indicates worsening neurologic status and possible rising intracranial pressure. Rapid deterioration can lead to herniation. Early detection and intervention are critical to prevent irreversible brain injury. Question 2. True or false, administering hypotonic intravenous fluids is the standard of care for a patient with increased intracranial pressure? Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option B, false. False. Hypotonic fluids like 0.45% normal saline shift fluid into brain cells and worsen cerebral edema. Isotonic or hypertonic solutions are preferred. Question 3. Which medication is an osmotic diuretic commonly used to reduce intracranial pressure? Option A, aspirin. Option B, mannitol. Option C, lisinopril. Option D, ibuprofen. The correct answer is option B, mannitol. Mannitol increases serum osmolality and draws fluid from the brain tissue into the vascular space, reducing intracranial pressure. Question 4. Teaching the client with gonorrhea how to prevent reinfection and further spread is an example of. Option A, primary prevention. Option B, secondary prevention. Option C, tertiary prevention. Option D, primary healthcare prevention. The correct answer is option B, secondary prevention. Secondary prevention targets the reduction of disease prevalence and disease morbidity through early diagnosis and treatment. Question 5. Which of the following foods is a complete protein? Option A, corn. Option B, eggs. Option C, peanuts. Option D, sunflower seeds. The correct answer is option B, eggs. Eggs are a complete protein. The remaining options are incomplete proteins. Question 6. Broccoli and oranges and dark greens and dark yellow vegetables can be eaten to. Option A, supplement vitamin pills. Option B, a balance body molecules. Option C, cure many diseases. Option D, help improve body defenses. The correct answer is option D, help improve body defenses. Certain foods can help improve body defenses to possibly prevent certain diseases. Question 7. The major electrolytes in the extracellular fluid are. Option A, potassium and chloride. Option B, potassium and phosphate. Option C, sodium and chloride. Option D, sodium and phosphate. The correct answer is option C, sodium and chloride. Sodium and chloride are the major electrolytes in the extracellular fluid. Question 8. Which of the following nursing diagnoses might be appropriate as Parkinson's disease progresses and complications develop? Option A, impaired physical mobility. Option B, dysreflexia. Option C, hypothermia. Option D, impaired dentition. The correct answer is option A, impaired physical mobility. The client with Parkinson's disease can develop a shuffling gait and rigidity causing impaired physical mobility. Question 9. Which of the following is an inappropriate item to include in planning care for a severely neutropenic client? Option A, transfuse neutrophils to prevent infection. Option B, to exclude raw vegetables from the diet. Option C, avoid administering rectal suppositories. Option D, prohibit vases of fresh flowers and plants in the room. The correct answer is option A, transfuse neutrophils to prevent infection. Granulocyte transfusion is not indicated to prevent infection. They can be beneficial in a selected population of infected and severely granulocytopenic clients who do not respond to antibiotic therapy. Question 10. A primary belief of psychiatric mental health nursing is. Option A, most people have the potential to change and grow. Option B, every person is worthy of dignity and respect. Option C, the human needs are individual to each person. Option D, some behaviors have no meaning and cannot be understood. The correct answer is option B, every person is worthy of dignity and respect. A primary belief is that every person is worthy of dignity and respect. All behavior has meaning and can be understood from the perspective of the client. Question 11. A teenage client is admitted to the hospital because of acetaminophen overdose. Overdoses of acetaminophen can precipitate life-threatening abnormalities in which of the following organs? Option A, lungs. Option B, liver. Option C, kidneys. Option D, the adrenal glands. The correct answer is option B, liver. Acetaminophen is extensively metabolized in the liver and an overdose can cause life-threatening liver damage. Question 12. All of the following factors when identified in the history of a family are correlated with poverty except option A, high infant mortality rate. Option B, a frequent use of emergency departments. Option C, consultation with folk healers. Option D, low incidence of dental problems. The correct answer is option D, low incidence of dental problems. Dental problems are actually prevalent in poverty because of the lack of preventive care and access to care. Question 13. Acyclovir is the drug of choice for option A, human immunodeficiency virus. Option B, herpes simplex virus type 1 and 2 and varicella zoster virus. Option C, cytomegalovirus. Option D, influenza A viruses. The correct answer is option B, herpes simplex virus type 1 and 2 and varicella zoster virus. Acyclovir is specific for treatment of herpes virus infections by inhibiting viral deoxyribonucleic acid replication. Question 14. Ashley and her boyfriend Chris are transported to the emergency department after a motorcycle accident. Chris is badly hurt but Ashley has no apparent injuries though she appears confused and has trouble focusing. Her pulse is rapid and she is hyperventilating. The nurse should assess Ashley's anxiety as option A, mild. Option B, moderate. Option C, severe. Option D, panic. The correct answer is option C, severe. Severe anxiety is characterized by an inability to solve problems and a poor grasp of the environment along with somatic symptoms and vital sign changes. Question 15. Which of the following methods of contraception is able to reduce the transmission of human immunodeficiency virus and other sexually transmitted diseases? Option A, intrauterine device. Option B, Norplant. Option C, oral contraceptives. Option D, a vaginal sponge. The correct answer is option D, vaginal sponge. The vaginal sponge is a barrier method of contraception that reduces the transmission of diseases and the risk of pregnancy. Question 16. Which fetal heart monitor pattern can indicate cord compression? Option A, variable decelerations. Option B, early decelerations. Option C, bradycardia. Option D, tachycardia. The correct answer is option A, variable decelerations. Variable decelerations in the fetal heart monitor pattern are typically related to umbilical cord compression. Question 17. The nurse teaching about preventable diseases should emphasize the importance of getting the following vaccines. Option A, human papilloma virus and genital herpes and measles. Option B, the pneumonia and human immunodeficiency virus and mumps. Option C, syphilis and gonorrhea and pneumonia. Option D, polio and pertussis and measles. The correct answer is option D, polio and pertussis and measles. Polio and pertussis and measles are mostly controlled by routine childhood immunization and have not been eradicated. Question 18. Which of the following conditions is mammography used to detect? Option A, pain. Option B, tumor. Option C, edema. Option D, epilepsy. The correct answer is option B, tumor. Mammography is a diagnostic tool used to detect tumors or cysts in the breast tissue. Question 19. When the nurse is determining the appropriate size of an oropharyngeal airway to insert, what part of a client's body should she measure? Option A, corner of the mouth to the tragus of the ear. Option B, corner of the eye to the top of the ear. Option C, tip of the chin to the sternum. Option D, tip of the nose to the earlobe. The correct answer is option A, corner of the mouth to the tragus of the ear. An oropharyngeal airway is measured from the corner of the client's mouth to the tragus of the ear for proper sizing. Question 20. Which sign might the nurse see in a client with a high ammonia level? Option A, coma. Option B, edema. Option C, hypoxia. Option D, polyuria. The correct answer is option A, coma. A high ammonia level in the blood can lead to hepatic encephalopathy and eventually a coma. Question 21. What do the following arterial blood gas values indicate? pH 7.38 and partial pressure of oxygen 78 and partial pressure of carbon dioxide 36 and bicarbonate 24? Option A, metabolic alkalosis. Option B, homeostasis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option B, homeostasis. These arterial blood gas values are all within the normal limits, which indicates homeostasis. Question 22. Which of the following is the primary force in sex education in a child's life? Option A, school nurse. Option B, peers. Option C, parents. Option D, media. The correct answer is option C, parents. Parents are considered the primary force in sex education in a child's life, followed by the school nurse and peers. Question 23. The nurse is assessing the dental status of an 18-month-old child. How many teeth should the nurse expect to examine? Option A, 6. Option B, 8. Option C, 12. Option D, 16. The correct answer is option C, 12. A general guide is to subtract 6 from the number of months of age. For an 18-month-old, the calculation is 18 minus 6, which equals 12 teeth. Question 24. Which of the following medications is a serotonin antagonist that might be used to relieve nausea and vomiting? Option A, metoclopramide. Option B, ondansetron. Option C, hydroxyzine. Option D, prochlorperazine. The correct answer is option B, ondansetron. Ondansetron is a serotonin antagonist used to relieve nausea and vomiting. Question 25. A client is complaining of difficulty walking secondary to a mass in the foot. The nurse should document this finding as option A, plantar fasciitis. Option B, hallux valgus. Option C, hammer toe. Option D, Morton's neuroma. The correct answer is option D, Morton's neuroma. Morton's neuroma is a small mass or tumor in a digital nerve of the foot that causes difficulty walking. Question 26. For a client with suspected appendicitis, the nurse should expect to find abdominal tenderness in which quadrant? Option A, upper right. Option B, upper left. Option C, lower right. Option D, lower left. The correct answer is option C, lower right. Abdominal tenderness in the lower right quadrant is a classic finding in a client with appendicitis. Question 27. Assessment of a client with a cast should include option A, capillary refill and warm toes and no discomfort. Option B, posterior tibial pulses and warm toes. Option C, moist skin and pain threshold. Option D, discomfort of the metacarpals. The correct answer is option A, capillary refill and warm toes and no discomfort. Assessment for adequate circulation is necessary. Signs of impaired circulation include slow capillary refill and cool extremities and pain. Question 28. Which of the following injuries, if demonstrated by a client entering the emergency department, is the highest priority? Option A, open leg fracture. Option B, open head injury. Option C, stab wound to the chest. Option D, a traumatic amputation of a thumb. The correct answer is option C, stab wound to the chest. A stab wound to the chest is the highest priority because it can result in lung collapse and death and follows the airway and breathing and circulation priority. Question 29. Trauma clothing is potential evidence with legal implications. Why must the nurse not cut through or disrupt any tears or bloodstains? Option A. The clothing is property of another. Option B. Such care facilitates repair. Option C. The clothing is potential evidence with legal implications. Option D. Such care decreases trauma to family members. The correct answer is option C. The clothing is potential evidence with legal implications. Clothing and stains are sources of potential evidence in trauma cases and must be preserved for legal and forensic implications. Question 30. Which of the following statements does not indicate a need for further teaching about newborn cord care? Option A. I should put alcohol on the cord 4 times a day. Option B. I should put the diaper so it covers the cord. Option C. I should call the physician if the cord turns dark. Option D. I should wash my hands before and after I take care of the cord. The correct answer is option D. I should wash my hands before and after I take care of the cord. Washing hands before and after cord care prevents the transfer of pathogens and is the correct technique. Question 31. A middle-aged woman has been experiencing irregular menses for the past 6 months. The nurse should assess for other symptoms of Option A. Climacteric. Option B. Menopause. Option C. Perimenopause. Option D. Postmenopause. The correct answer is option C. Perimenopause. Perimenopause is the period when hormonal changes occur gradually and menses become irregular before permanent cessation. Question 32. Which of the following might be an appropriate nursing diagnosis for an epileptic client? Option A. Dysreflexia. Option B. Risk for injury. Option C. Urinary retention. Option D. Unbalanced nutrition. The correct answer is option B. Risk for injury. The epileptic client is at high risk for injury due to the complications of seizure activity and potential falls. Question 33. Which of the following diseases is least likely to be associated with an increased potential for bleeding? Option A. Metastatic liver cancer. Option B. Gram-negative septicemia. Option C. Pernicious anemia. Option D. Iron deficiency anemia. The correct answer is option C. Pernicious anemia. Pernicious anemia results from vitamin B12 deficiency and is not primarily associated with bleeding risks like liver cancer or septicemia. Question 34. When a client needs oxygen therapy, what is the highest flow rate that oxygen can be delivered via nasal cannula? Option A. 2 liters per minute. Option B. 4 liters per minute. Option C. 6 liters per minute. Option D. 8 liters per minute. The correct answer is option C. 6 liters per minute. The highest flow rate for a nasal cannula is 6 liters per minute. Higher rates require a mask. Question 35. The kind of man who beats a woman is Option A. From a minority culture in a low-income group. Option B. From a majority culture in a middle-income group. Option C. One who was never allowed to compete as a child. Option D. From any walk of life and race and income group. The correct answer is option D. From any walk of life and race and income group. Batterers cannot be predicted by demographic features and come from all races and socioeconomic statuses. Question 36. All of the following should be performed when fetal heart monitoring indicates fetal distress except Option A. Increase maternal fluids. Option B. Administer oxygen. Option C. Decrease maternal fluids. Option D. Turn the mother. The correct answer is option C. Decrease maternal fluids. Decreasing maternal fluids is incorrect as maintaining or increasing fluids helps improve placental perfusion during fetal distress. Question 37. What interpersonal relief behavior is a client using when emotional conflict is experienced as a physical symptom? Option A. Acting out. Option B. Somatizing. Option C. Withdrawal. Option D. Problem solving. The correct answer is option B. Somatizing. Somatizing is the process of experiencing emotional conflict as a physical symptom such as nausea or dizziness. Question 38. A client weighs 216 pounds and is 66 inches tall. The body mass index is 35. The nurse identifies this status as Option A. Normal. Option B. Lower than normal. Option C. Obesity. Option D. Overweight. The correct answer is option C. Obesity. A body mass index of 30 or more is defined as obesity. A body mass index of 35 indicates the client is obese. Question 39. Which of the following instructions should the nurse give a client who will be undergoing mammography? Option A. Be sure to use underarm deodorant. Option B. Do not use underarm deodorant. Option C. Do not eat or drink after midnight. Option D. Have a friend drive you home. The correct answer is option B. Do not use underarm deodorant. Underarm deodorant should not be used because it can cause shadows on the film that look like tumors or cysts. Question 40. Teaching about the need to avoid foods high in potassium is most important for which client? Option A. A client receiving diuretic therapy. Option B. A client with an ileostomy. Option C. A client with metabolic alkalosis. Option D. A client with renal disease. The correct answer is option D. A client with renal disease. Clients with renal disease are at high risk for hyperkalemia because the kidneys cannot excrete potassium effectively. Question 41. A diet high in fiber content can help an individual to: Option A. Lose body weight fast. Option B. Reduce diabetic ketoacidosis. Option C. Lower cholesterol. Option D. Reduce the need for folate. The correct answer is option C. Lower cholesterol. Fiber-rich foods such as grains and beans can help lower cholesterol levels. Question 42. When administering intravenous electrolyte solutions, what precautions should the nurse take? Option A. Infuse hypertonic solutions rapidly. Option B. Mix no more than 80 milliequivalents of potassium per liter. Option C. Prevent infiltration of calcium to avoid tissue necrosis. Option D. Increased digitalis dosage if calcium is given. The correct answer is option C. Prevent infiltration of calcium to avoid tissue necrosis. Preventing tissue infiltration of calcium is vital because it can cause tissue necrosis and sloughing. Question 43. How often should the nurse change the intravenous tubing on total parenteral nutrition solutions? Option A. Every 24 hours. Option B. Every 36 hours. Option C. Every 48 hours. Option D. Every 72 hours. The correct answer is option A. Every 24 hours. Tubing for total parenteral nutrition must be changed every 24 hours due to the high risk of bacterial growth in the glucose-rich solution. Question 44. A woman asks how much alcohol she can safely drink while pregnant. What is the best response? Option A. The amount that is safe is unknown. Option B. 1 beer or glass of wine a day is safe. Option C. 3 or more drinks on one occasion is the only harm. Option D. You can have a drink to help you sleep. The correct answer is option A. The amount that is safe is unknown. The amount of alcohol that is safe during pregnancy is unknown, and any consumption can lead to fetal alcohol syndrome. Question 45. A 10-month-old child is difficult to awaken and has bruises on both upper arms. These findings are most consistent with: Option A. Wearing small clothing. Option B. The child being shaken. Option C. Falling while learning to walk. Option D. Parents trying to awaken the child. The correct answer is option B. The child being shaken. Bruising on both upper arms and a decreased level of consciousness are classic signs of shaken baby syndrome. Question 46. For which of the following conditions might blood be drawn for a uric acid level? Option A. Asthma. Option B. Gout. Option C. Diverticulitis. Option D. Meningitis. The correct answer is option B. Gout. Uric acid levels are elevated in clients with gout and are used as a diagnostic indicator. Question 47. A client with disseminated intravascular coagulation is on a heparin drip. Which finding indicates a positive response to therapy? Option A. Increased platelet count. Option B. Increased fibrinogen. Option C. Decreased fibrin split products. Option D. Decreased bleeding. The correct answer is option B. Increased fibrinogen. Effective heparin therapy in disseminated intravascular coagulation results in increased availability of fibrinogen by interfering with the conversion process. Question 48. Which of the following is an appropriate nursing goal for a client at risk for nutritional problems? Option A, provide oxygen. Option B, promote healthy nutritional practices. Option C, treat complications of malnutrition. Option D, increase weight. The correct answer is option B, promote healthy nutritional practices. Promoting healthy nutritional practices is a primary goal for clients at risk for nutritional issues. Question 49. Major competencies for the nurse giving end-of-life care include: Option A, demonstrating respect and applying knowledge in care of the family. Option B, assessing to support total management. Option C, setting goals and dynamic changes. Option D, keeping all sad news away from the family. The correct answer is option A, demonstrating respect and applying knowledge in care of the family. Demonstrating respect and compassion while applying clinical skills for both the client and family are major competencies in end-of-life care. Question 50. Following a classic cholecystectomy, the nurse observes serosanguineous drainage on the dressing. The most appropriate intervention is to: Option A, notify the physician. Option B, change the dressing. Option C, reinforce the dressing. Option D, apply an abdominal binder. The correct answer is option C, reinforce the dressing. Serosanguineous drainage is expected after this surgery, and the dressing should be reinforced rather than changed to prevent infection. Question 51. A client turns her ankle and is diagnosed with a pulled ligament. This should be documented as a: Option A, a sprain. Option B, a strain. Option C, subluxation. Option D, distortion. The correct answer is option B, strain. A strain is defined as the excessive stretching of a ligament. Question 52. An appropriate intervention for the client with suspected genitourinary trauma and visible blood at the urethral meatus is: Option A, insertion of a Foley catheter. Option B, in and out catheter specimen. Option C, voided urine specimen. Option D, a urologist consult. The correct answer is option D, a urologist consult. Visible blood at the meatus indicates potential urethral injury, and a urologist should be consulted before any catheterization is attempted. Question 53. A client with Kawasaki disease has hand and foot edema and a strawberry tongue. What measure is most appropriate to meet the outcome of a positive body image? Option A, administering immune globulin intravenously. Option B, assessing extremities for redness every 8 hours. Option C, explaining the progression of the disease to the family. Option D, assessing heart sounds and rhythm. The correct answer is option C, explaining the progression of the disease to the family. Explaining that the physical symptoms will resolve as the disease progresses helps the client and family maintain a positive body image. Question 54. A client with Hodgkin's disease is starting chemotherapy including nitrogen mustard and prednisone. Which side effect contributes most to an altered body image? Option A, Cushingoid appearance. Option B, alopecia. Option C, sterility. Option D, pathologic fractures. The correct answer is option B, alopecia. Alopecia or hair loss is a very common side effect of chemotherapy that significantly impacts a client's body image. Question 55. A pregnant woman requests that a medicine woman be present in the examination room. Which response by the nurse is appropriate? Option A, I will assist you in arranging to have her present. Option B, we do not allow medicine women in exam rooms. Option C, that does not make any difference in the outcome. Option D, it is old-fashioned to believe in that. The correct answer is option A, I will assist you in arranging to have her present. Assisting with the request reflects cultural awareness and acceptance of the client's support system. Question 56. The goals of palliative care include all of the following except: Option A, giving clients the best quality of life possible. Option B, taking care of the whole person. Option C, no interventions are needed because death is near. Option D, supportive needs of the family and client. The correct answer is option C, no interventions are needed because death is near. Palliative care involves active interventions to support the physical and emotional and spiritual needs of the client until the end of life. Question 57. When helping a client gain insight into anxiety, the nurse should: Option A, help relate anxiety to specific behaviors. Option B, ask the client to describe events that precede increased anxiety. Option C, instruct the client to practice relaxation. Option D, confront the client's resistive behavior. The correct answer is option B, ask the client to describe events that precede increased anxiety. To gain insight, the client needs to recognize the causal events and triggers that lead to increased anxiety. Question 58. A young boy is diagnosed with a seizure disorder. Which statement by the mother indicates a need for further teaching? Option A, I should make sure he gets plenty of rest. Option B, I should get him a medical alert bracelet. Option C, I should lay him on his back during a seizure. Option D, I should loosen his clothing during a seizure. The correct answer is option C, I should lay him on his back during a seizure. A client having a seizure should be turned to the side to prevent aspiration of secretions. Question 59. To remove hard contact lenses from an unresponsive client, the nurse should: Option A, gently irrigate the eye from the inner canthus. Option B, grasp the lens with a pinching motion. Option C, don sterile gloves before the procedure. Option D, ensure the lens is centered on the cornea before manipulating the lids. The correct answer is option D, ensure the lens is centered on the cornea before manipulating the lids. The lens must be centered on the cornea before the lids are manipulated to slide the lens out of the eye. Question 60. Which of the following foods might a client with hypercholesterolemia need to decrease intake of? Option A, broiled catfish. Option B, hamburgers. Option C, wheat bread. Option D, fresh apples. The correct answer is option B, hamburgers. Hamburgers are high in red meat and cholesterol and should be limited in a low cholesterol diet. Question 61. Nurses caring for clients with cancer taking opioids need to assess for all of the following except: Option A, tolerance. Option B, constipation. Option C, sedation. Option D, addiction. The correct answer is option D, addiction. Addiction is not a primary concern for terminally ill clients. Assessment should focus on managing side effects like constipation and sedation. Question 62. Which of the following nursing actions is most effective when evaluating a kinetic family drawing? Option A, telling the child to draw their family doing something. Option B, offering specific suggestions of what to include. Option C, discouraging the child from talking about it. Option D, noting the omission of any family members. The correct answer is option D, noting the omission of any family members. Noting who is omitted or how family members are placed provides significant diagnostic data in a kinetic family drawing. Question 63. A client with an ileus is on intestinal tube suction. Which of the following electrolytes is lost with intestinal suction? Option A, calcium. Option B, magnesium. Option C, potassium. Option D, sodium chloride. The correct answer is option D, sodium chloride. Duodenal fluid is rich in sodium and chloride and potassium and bicarbonate, so suctioning removes these electrolytes. Question 64. Which of the following terms refers to soft tissue injury caused by blunt force? Option A, a contusion. Option B, a strain. Option C, a sprain. Option D, dislocation. The correct answer is option A, contusion. A contusion is a soft tissue injury caused by blunt force that does not break the skin but causes swelling and pain. Question 65. Which of the following indicates a hazard for a client on oxygen therapy? Option A, a no smoking sign is on the door. Option B, the client is wearing a synthetic gown. Option C, electrical equipment is grounded. Option D, matches are removed. The correct answer is option B. The client is wearing a synthetic gown. Synthetic gowns can generate static electricity sparks, which are a fire hazard in an oxygen-rich environment. Cotton is preferred. Question 66. Erythropoietin used to treat anemia in clients with renal failure should be given in conjunction with: Option A, iron and folic acid and vitamin B12. Option B, an increase of protein in the diet. Option C, of vitamins A and C. Option D, an increase of calcium in the diet. The correct answer is option A, iron and folic acid and vitamin B12. Adequate iron and folate and B12 are necessary for the body to produce red blood cells even when erythropoietin is provided. Question 67. When obtaining a health history on a menopausal woman, which information is a contraindication for hormone replacement therapy? Option A, family history of stroke. Option B, ovaries removed before age 45. Option C, frequent hot flashes. Option D, unexplained vaginal bleeding. The correct answer is option D, unexplained vaginal bleeding. Unexplained vaginal bleeding must be investigated and is a direct contraindication for starting hormone replacement therapy. Question 68. A pregnant client wants to take ginger to relieve morning sickness, nausea. Which response by the nurse is appropriate? Option A, I will call your physician to see if we can start ginger. Option B, we don't use home remedies in this clinic. Option C, herbs are not as effective as regular medicines. Option D, just eat some dry crackers instead. The correct answer is option A, I will call your physician to see if we can start ginger. Ginger is a recognized herbal remedy for nausea, and the nurse should consult with the physician to ensure it is safe for the client. Question 69. Which physical finding indicates that an 11-month-old child is at risk for developmental dysplasia of the hip? Option A, a refusal to walk. Option B, not pulling to a standing position. Option C, negative Trendelenburg sign. Option D, negative Ortolani sign. The correct answer is option B, not pulling to a standing position. An 11-month-old child should be able to pull to a standing position, and failure to do so may indicate hip dysplasia. Question 70. A client with which of the following conditions is at risk for developing a high ammonia level? Option A, renal failure. Option B is psoriasis. Option C, lupus. Option D is cirrhosis. The correct answer is option D, cirrhosis. In cirrhosis, the liver cannot convert ammonia to urea, leading to dangerously high levels of ammonia in the blood. Question 71. What is the primary nutritional deficiency of concern for a strict vegetarian? Option A, of vitamin C. Option B, of vitamin B12. Option C, of vitamin E. Option D, magnesium. The correct answer is option B, vitamin B12. Vitamin B12 is found primarily in animal products, so strict vegetarians are at high risk for this deficiency. Question 72. Which of the following foods should be avoided by clients who are prone to develop heartburn from gastroesophageal reflux disease? Option A, lettuce. Option B, eggs. Option C, chocolate. Option D, butterscotch. The correct answer is option C, chocolate. Chocolate can reduce the pressure of the lower esophageal sphincter, which allows acid to reflux into the esophagus. Question 73. A client has been taking alprazolam for 4 years for anxiety. Which statement indicates the client understands how to discontinue the medication? Option A, I can drink alcohol now that I am decreasing it. Option B, I should not take another pill and stop today. Option C, I should take 3 pills next week, then 2, then 1 over several weeks. Option D, I can expect to be sleepy for several days after stopping. The correct answer is option C. I should take 3 pills next week, then 2, then 1 over several weeks. Benzodiazepines like alprazolam must be tapered slowly to prevent severe withdrawal symptoms such as seizures and agitation. Question 74. A client taking hydrocodone for chronic pain requires an increase in the dose. The nurse should explain this as: Option A, the body has developed tolerance. Option B, the client is experiencing drug dependence. Option C, addiction is physical dependence with withdrawal. Option D, the client has a dual diagnosis. The correct answer is option A, the body has developed tolerance. Drug tolerance occurs when the body requires a larger dose to produce the same analgesic effect over time. Question 75. A safety measure to implement when transferring a client with hemiparesis from a bed to a wheelchair is: Option A, standing the client and walking to the chair. Option B, moving the chair close and pivoting the client on the unaffected extremity. Option C, moving the chair close and pivoting the client on the affected extremity. Option D, having the client stand and push their body. The correct answer is option B, moving the chair close and pivoting the client on the unaffected extremity. Pivoting on the unaffected or stronger limb provides the most support and stability during the transfer. Question 76. A client with dumping syndrome should lie down after meals, while a client with gastroesophageal reflux disease should. Option A, sit up after meals. Option B, lie down after meals. Option C, walk after meals. Option D, exercise after meals. The correct answer is option A, sit up after meals. Clients with dumping syndrome lie down to slow gastric emptying, while those with reflux sit up to prevent acid from moving back into the esophagus. Question 77. Which of the following organs of the digestive system has a primary function of absorption? Option A, stomach. Option B, pancreas. Option C, small intestine. Option D, gallbladder. The correct answer is option C, small intestine. The small intestine is the primary site for the absorption of nutrients in the digestive system. Question 78. Which of the following neurological disorders is characterized by writhing and twisting movements of the face and limbs? Option A, epilepsy. Option B, Parkinson's. Option C, muscular sclerosis. Option D, Huntington's chorea. The correct answer is option D, Huntington's chorea. Huntington's chorea is a genetic neurological disorder characterized by involuntary writhing and twisting movements. Question 79. The nurse is teaching parents of a newborn about feeding. Which instruction should be included? Option A, use the defrost setting on microwave ovens to warm bottles. Option B, feed the baby partially used bottles after 24 hours. Option C, mix 2 parts water and 1 part formula concentrate. Option D, add new formula to a partially used bottle. The correct answer is option A. Use the defrost setting on microwave ovens to warm bottles. If a microwave is used, the defrost setting is safest, but the temperature must always be checked to prevent burns. Question 80. A client who is immobilized in traction is complaining of constipation. Which medication is likely to be ordered? Option A, Advil. Option B, Anacid. Option C, Clinicil. Option D, Colis. The correct answer is option D, Colis. Colis is a stool softener commonly used for immobilized clients to prevent constipation by pulling water into the bowel. Question 81. Which of the following meals is most likely to cause rapid emptying of the stomach in a client after gastric resection? Option A, a high-protein meal. Option B, a high-fat meal. Option C, a large meal regardless of content. Option D, a high-carbohydrate meal. The correct answer is option D, a high-carbohydrate meal. High-carbohydrate meals promote rapid gastric emptying, which can lead to dumping syndrome in post-surgical clients. Question 82. A batterer in domestic violence is usually someone who: Option A, grew up in a loving and secure home. Option B, was an only child. Option C, was physically or psychologically abused as a child. Option D, admits he has a problem with anger. The correct answer is option C, was physically or psychologically abused as a child. Many individuals who become batterers report a history of being abused themselves during childhood. Question 83. A client is preparing to have gastric bypass surgery for weight loss. Which response by the nurse is most appropriate? Option A, if you eat less you can save money. Option B, exercise is a healthier way to lose weight. Option C, you should try the Atkins diet first. Option D, I respect your decision to choose surgery. The correct answer is option D, I respect your decision to choose surgery. Showing respect for the client's decision and empathy is the most professional and therapeutic response. Question 84. In teaching a client in bucks traction, what are the major areas of importance? Option A, in nutrition and range of motion exercises. Option B, range of motion and transportation. Option C, in nutrition and elimination and comfort and safety. Option D. Elimination and safety and isotonic exercises. The correct answer is option C. Nutrition and elimination and comfort and safety. Maintaining nutrition and elimination and ensuring comfort and safety are the priorities for a client in Skin Traction. Question 85. Light therapy can be effective for which of the following conditions? Option A. Overcoming weight problems. Option B. Helping with allergies. Option C. Alternative medical treatments. Option D. Working with sleep patterns. The correct answer is option D. Working with sleep patterns. Light therapy is used to treat seasonal affective disorder and to help regulate sleep patterns and circadian rhythms. Question 86. Assessment of a client with an arteriovenous fistula for hemodialysis should include: Option A. Inspection for visible pulsation. Option B. Palpation of thrill. Option C. Percussion for dullness. Option D. Auscultation of blood pressure. The correct answer is option B. Palpation of thrill. A palpable thrill and an audible bruit are the primary signs that an arteriovenous fistula is patent and functioning. Question 87. A student returns home angry at a teacher and kicks the dog. This coping mechanism is known as: Option A. Denial. Option B. Suppression. Option C. Displacement. Option D. Fantasy. The correct answer is option C. Displacement. Displacement is the transference of feelings or anger from a threatening target to a less threatening one, such as a pet. Question 88. Which condition is associated with an inadequate intake of vitamin C? Option A. Rickets. Option B. Marasmus. Option C. Kwashiorkor. Option D is scurvy. The correct answer is option D. Scurvy. Scurvy is the disease caused by a deficiency of vitamin C and is characterized by bleeding gums and poor wound healing. Question 89. Which is the proper hand position for performing chest percussion? Option A. Cup the hands. Option B. Use the side of the hands. Option C. Flatten the hands. Option D. Spread the fingers of both hands. The correct answer is option A. Cup the hands. Hands are cupped during chest percussion to create a vibration that helps loosen respiratory secretions. Question 90. Which of the following is likely to increase the risk of a sexually transmitted disease? Option A. Alcohol use. Option B is certain sexual practices. Option C. Oral contraception use. Option D. All of the above. The correct answer is option D. All of the above. Alcohol use and high-risk sexual practices and the use of oral contraceptives without barrier protection all increase the risk of disease transmission. Question 91. Why might breast implants interfere with mammography? Option A. They might cause additional discomfort. Option B. They are contraindications. Option C. They are likely to be dislodged. Option D. They might prevent detection of masses. The correct answer is option D. They might prevent detection of masses. Breast implants can obscure breast tissue and potentially hide small masses during a mammogram. Question 92. A healthcare worker is concerned about a new mother being overwhelmed by infant care. The best action is to: Option A. Contact Child Protective Services. Option B. Provide literature about child care. Option C. Consult a therapist for her fears. Option D. Refer the mother to parenting classes. The correct answer is option D. Refer the mother to parenting classes. Parenting classes help build confidence and coping skills and provide social support for new parents. Question 93. Which is the proper hand position for performing chest vibration? Option A. Cup the hands. Option B. Use the side of the hands. Option C. Flatten the hands. Option D. Spread the fingers of both hands. The correct answer is option C. Flatten the hands. The hands are flattened over the chest wall to conduct vibrations that help loosen and move secretions. Question 94. Which of the following laboratory values is associated with a decreased risk of cardiovascular disease? Option A. High-density lipoprotein cholesterol. Option B. Low-high-density lipoprotein cholesterol. Option C. Low total cholesterol. Option D. Low triglycerides. The correct answer is option A, high-density lipoprotein cholesterol. High levels of high-density lipoprotein cholesterol are protective and associated with a lower risk of heart disease. Question 95. When making an occupied bed, it is important for the nurse to: option A, keep the bed in the low position. Option B, use a bath blanket for warmth and privacy. Option C, keep side rails raised on both sides. Option D, move back and forth constantly. The correct answer is option B, use a bath blanket for warmth and privacy. Using a bath blanket maintains the client's dignity and provides warmth while the linens are being changed. Question 96. When a client experiences hypoglycemia, the nurse should provide immediate intervention by giving: option A, 1 glucose tablet. Option B, 2 hard candies. Option C, juice with added sugar. Option D, 2 to 3 teaspoons of honey. The correct answer is option D, 2 to 3 teaspoons of honey. Fast-acting simple carbohydrates like honey or fruit juice are used to quickly raise blood glucose levels. Question 97. A client is having a seizure and oxygen saturation drops to 82%. What should the nurse do first? Option A, open the airway. Option B, administer oxygen. Option C, suction the client. Option D, check for breathing. The correct answer is option A, open the airway. Opening the airway is the first priority when oxygen saturation drops during a seizure to ensure the client can breathe. Question 98. To remove a client's gown when they have an intravenous line, the nurse should: option A, disconnect the tubing temporarily. Option B, cut the gown with scissors. Option C, thread the bag and tubing through the sleeve. Option D, disconnect the tubing from the container. The correct answer is option C, thread the bag and tubing through the sleeve. Threading the bag through the sleeve keeps the intravenous system closed and sterile, preventing infection. Question 99. Which of the following is most likely to impact the body image of an infant newly diagnosed with hemophilia? Option A, immobility. Option B, altered growth and development. Option C, hemarthrosis. Option D, altered family processes. The correct answer is option D, altered family processes. Stresses on the family and how caregivers respond to the infant's needs can have an immediate impact on development and trust. Question 100. Which of the following values should the nurse monitor closely while a client is on total parenteral nutrition? Option A, calcium. Option B, magnesium. Option C, glucose. Option D, cholesterol. The correct answer is option C, glucose. Glucose must be monitored frequently because total parenteral nutrition contains high concentrations of dextrose. Question 101. A client with stress incontinence should be advised that: option A, they should purchase absorbent undergarments. Option B, Kegel exercises might help. Option C, surgical treatments are non-existent. Option D, behavioral therapy is ineffective. The correct answer is option B, Kegel exercises might help. Kegel exercises strengthen the pelvic floor muscles and are an effective treatment for stress incontinence. Question 102. Diagnostic genetic counseling for procedures like amniocentesis allows clients to do all except: option A, terminating the pregnancy. Option B, preparing for a child with special needs. Option C, accessing support services. Option D, completing the grieving process before birth. The correct answer is option D, completing the grieving process before birth. Grieving is a process that continues after the birth or loss and will not be completed before the child is born. Question 103. A client experiencing infertility feels incomplete as a person. Which nursing diagnosis is appropriate? Option A, risk for self-harm. Option B, a body image disturbance. Option C, ineffective role performance. Option D, powerlessness. The correct answer is option B, body image disturbance. Feeling incomplete due to the loss of reproductive function directly relates to a disturbance in body image. Question 104. An assessment of the skull of a normal 10-month-old baby should identify: option A, a closure of the posterior fontanelle. Option B, closure of the anterior fontanelle. Option C, overlap of cranial bones. Option D, ossification of the sutures. The correct answer is option A, closure of the posterior fontanelle. The posterior fontanelle should be closed by 2 months of age, while the anterior fontanelle closes between 12 and 18 months. Question 105. Attaching a restraint to a side rail or movable part of the bed can: Option A, do nothing to the client. Option B, injure the client if the rail is moved. Option C, help the client stay in bed. Option D, help the client with posture. The correct answer is option B, injure the client if the rail is moved. Restraints must be attached to the bed frame so that moving the rails or the head of the bed does not cause injury. Question 106. Chemotherapeutic DNA alkylating agents are effective because they: Option A, cross-link DNA strands. Option B, have few side effects. Option C, treat multiple types of cancer. Option D, are cell cycle specific. The correct answer is option A, cross-link DNA strands. These agents introduce radicals that cross-link DNA and prevent replication and transcription of cancer cells. Question 107. Using clichés in therapeutic communication leads the client toward: Option A, viewing the nurse as human. Option B, accepting himself as human. Option C, self-disclosing. Option D, feeling discounted. The correct answer is option D, feeling discounted. Clichés are non-therapeutic and make the client feel that the nurse is not truly listening or caring. Question 108. Which of the following measures promote sleep? Option A, exercising vigorously at 9:30 p.m. Option B, taking a cool shower and drinking hot tea. Option C, watching television until midnight. Option D, getting a back rub and drinking warm milk. The correct answer is option D, getting a back rub and drinking warm milk. Warm milk and relaxation techniques like a back rub are effective ways to promote the onset of sleep. Question 109. Ethical and moral issues concerning restraints include all of the following except: Option A, emotional impact on the client. Option B, dignity of the client. Option C, client's quality of life. Option D, policies and procedures. The correct answer is option D, policies and procedures. While policies are important, they are administrative rather than ethical or moral considerations like dignity and quality of life. Question 110. A client is told that his test is positive, but in fact the client does not have the disease. This is A. Option A, positive. Option B, false positive. Option C, negative. Option D, false negative. The correct answer is option B, false positive. A false positive occurs when a test indicates a condition is present when it actually is not. Question 111. A nurse observes a client talking to voices. The nurse's next action should be: Option A, touching the client. Option B, leaving the client alone. Option C, asking the client to describe what is happening. Option D, telling the client there are no voices. The correct answer is option C, asking the client to describe what is happening. Asking the client about the hallucinations helps the client gain control and provides the nurse with assessment data. Question 112. The client's legally responsible party may make the decision for organ donation if the client is unable to do so. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. If a client is incapacitated, the legal next of kin or healthcare power of attorney has the authority to authorize organ donation. Question 113. High uric acid levels can develop in clients receiving chemotherapy due to: Option A, inability of kidneys to excrete metabolites. Option B, rapid cell catabolism. Option C, toxic effects of antibiotics. Option D, altered blood pH. The correct answer is option B, rapid cell catabolism. Chemotherapy causes rapid breakdown of cancer cells, and uric acid is a byproduct of that cellular catabolism. Question 114. A realistic short-term goal for a client who was raped is to: Option A, identify all psychosocial problems. Option B, eliminate enticing behaviors. Option C, resolve feelings of trauma. Option D, verbalize feelings about the event. The correct answer is option D, verbalize feelings about the event. Verbalizing feelings is an achievable short-term goal that helps the client begin to process the trauma. Question 115. The vast majority of deaths resulting from unintentional poisoning occur in: Option A, infants. Option B, toddlers. Option C, teens. Option D, adults. The correct answer is option B, toddlers. Toddlers are the age group most at risk for accidental poisoning due to their mobility and natural curiosity. Question 116. Common problems for supervisors include all of the following except: Option A, facilitating development of staff. Option B, micromanaging staff members. Option C, controlling the style of tasks. Option D, inability to delegate. The correct answer is option A, facilitating development of staff. Facilitating staff development is a positive goal, while micromanagement and lack of delegation are common supervisory pitfalls. Question 117. While assessing a client for signs of impending death, the nurse observes for: Option A, elevated blood pressure. Option B, Cheyne-Stokes respiration. Option C, elevated pulse rate. Option D, decreased temperature. The correct answer is option B, Cheyne-Stokes respiration. Cheyne-Stokes respirations are a rhythmic pattern of breathing often seen in clients approaching death. Question 118. A client with asthma develops respiratory acidosis. Based on this, the nurse should expect the potassium level to be: Option A, normal. Option B, elevated. Option C, low. Option D, unrelated to pH. The correct answer is option B, elevated. In acidosis, potassium shifts out of the cells and into the bloodstream, resulting in hyperkalemia. Question 119. The most common type of first-degree burn in small children is: Option A, scalding from hot water. Option B, contact with hot stoves. Option C, contact with flammable liquids. Option D, sunburn from lack of protection. The correct answer is option D, sunburn from lack of protection. Sunburn is the most prevalent first-degree burn and emphasizes the need for parental education on sun protection. Question 120. A widow states she will never learn to manage finances because her husband did it. Which response raises her self-esteem? Option A, you feel inadequate because you never learned. Option B, you should have insisted he teach you. Option C, you are strong and will learn in time. Option D, why don't you take a class at the college? The correct answer is option C, you are strong and will learn in time. Communicating confidence in the client's ability to learn new skills helps to bolster her self-esteem during a crisis. Question 121. At what point should the nurse alter or modify the care plan? Option A, halfway through the shift. Option B, at the end of the shift. Option C, when needs change. Option D, after top priority tasks are done. The correct answer is option C, when needs change. The nursing process is dynamic and the plan of care should be modified immediately whenever the client's needs or status change. Question 122. Signs of impaired breathing in infants and children include all except: Option A, a nasal flaring. Option B, grunting. Option C, seesaw breathing. Option D, quivering lips. The correct answer is option D, quivering lips. Nasal flaring and grunting and seesaw breathing are all signs of respiratory distress in children, but quivering lips is not. Question 123. A nurse manager makes eye contact and initiates conversation about work experience. This behavior is: Option A, aggressiveness. Option B, passive aggressiveness. Option C, passiveness. Option D, assertiveness. The correct answer is option D, assertiveness. Assertiveness involves direct and honest communication while respecting the rights of others. Question 124. What should the nurse do first to help a client determine a suitable diet for disease prevention? Option A. Provide approved dietary copies. Option B. Ask the client to provide a list of foods they eat. Option C. Provide a high protein plan. Option D. Provide information on risk factors. The correct answer is option B. Ask the client to provide a list of foods they eat. Assessment is always the first step. The nurse must know what the client currently eats before making recommendations. Question 125. A client becomes extremely somnolent with respiratory depression after an opiate. The nurse expects which medication? Option A. Naloxone. Option B. Labetalol. Option C. Neostigmine. Option D. Thiathixine. The correct answer is option A. Naloxone. Naloxone is an opiate antagonist used to reverse the effects of narcotic-induced respiratory depression. Question 126. Which of the following factors about erythema infectiosum is not correct? Option A. There is no rash. Option B. The disorder is uncommon in adults. Option C. There is no fever. Option D. There is a slapped face appearance. The correct answer is option B. The disorder is uncommon in adults. Erythema infectiosum or fifth disease is primarily a childhood illness and is indeed uncommon in adults. Question 127. By 12 months of age, a child should have been immunized against option A. Measles and polio. Option B. Diphtheria and pertussis and polio and tetanus. Option C. Rubella and hepatitis A. Option D. Mumps and rubella and polio. The correct answer is option B. Diphtheria and pertussis and polio and tetanus. The standard immunization schedule includes diphtheria and pertussis and tetanus and polio by the age of 1. Question 128. Which of the following are methods of preventing cancer? Option A. Sleep at least 6 to 8 hours a night. Option B. Practice monthly self-breast examination. Option C. Reduce stress. Option D. All of the above. The correct answer is option D. All of the above. Adequate sleep and regular self-examinations and stress reduction all contribute to overall health and cancer prevention. Question 129. A gynecologist is the physician who treats and manages disease of the female reproductive organs. Option A. True. Option B. False. Option C. Not applicable. Option D. Not applicable. The correct answer is option A. True. True. A gynecologist specializes in the health and diseases of the female reproductive system. Question 130. Which of the following observations is most important when assessing a client's breathing? Option A. A presence of breathing and pulse rate. Option B. A breathing pattern and adequacy. Option C. Presence of breathing and adequacy. Option D. Patient position and adequacy. The correct answer is option C. Presence of breathing and adequacy. It is critical to determine not just that the client is breathing but that the breathing is adequate to support oxygenation. Question 131. Several passengers aboard an airliner suddenly become weak and have breathing difficulty. The cause is likely option A. The Asian flu. Option B. Chemical exposure. Option C. Bacterial pneumonia. Option D. Allergic reaction. The correct answer is option B. Chemical exposure. Groups of people experiencing sudden similar symptoms simultaneously is a hallmark of environmental or chemical exposure. Question 132. The nurse observes bilateral bruises on the arms of an elderly client. Which question should the nurse ask? Option A. How did you get those bruises? Option B. Did someone grab you by your arms? Option C. Do you fall often? Option D. What did you bump against? The correct answer is option B. Did someone grab you by your arms? A direct and non-confrontational approach is best when there is a high suspicion of physical abuse. Question 133. In a psychosocial assessment, the step after describing problematic behaviors is to elicit the client's option A of feelings about the situation. Option B, thoughts about the situation. Option C, possible solutions. Option D, intent in sharing. The correct answer is option B, thoughts about the situation. After behavior is described, the nurse should assess the client's thoughts to understand their interpretation of the events. Question 134. Male survivors of sexual abuse might respond in which of the following ways? Option A is seldom have long-term problems. Option B, become confused about sexual identity. Option C, always grow up to abuse others. Option D, have the same needs as females. The correct answer is option B, become confused about sexual identity. Male survivors often experience confusion regarding their sexuality and may use alcohol or risky behavior to prove masculinity. Question 135. What significant event occurs in the orientation phase of a nurse-client relationship? Option A, the establishment of roles. Option B, identification of transference. Option C, placement within family structure. Option D, the agreement that the nurse has authority. The correct answer is option B, identification of transference. Transference phenomena where the client redirects feelings to the nurse must be identified and resolved during the early phases. Question 136. Which of the following ethnic groups is at highest risk for pesticide-related injuries? Option A, Native American. Option B, Asian Pacific. Option C, Norwegian. Option D, Hispanic. The correct answer is option D, Hispanic. Because a large percentage of migrant agricultural workers are Hispanic, they have a higher risk of exposure to pesticides. Question 137. To decrease a client's use of denial, the nurse should: Option A, tell the client to stop using denial. Option B, positively reinforce expression of feelings. Option C, instruct the client to express feelings. Option D, challenge the client each time. The correct answer is option B, positively reinforce expression of feelings. Providing positive reinforcement when the client expresses true feelings helps them move away from the defense mechanism of denial. Question 138. Biofeedback techniques can be used to release tension and counteract stress. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Biofeedback is a relaxation technique that helps clients gain voluntary control over physiological stress responses. Question 139. The focus of a nurse case manager is: Option A, nursing care needs at discharge. Option B, comprehensive care needs for continuity. Option C, client education at discharge. Option D, financial resources for care. The correct answer is option B, comprehensive care needs for continuity. Case management focuses on the comprehensive needs of the client to ensure continuity of care throughout the healthcare system. Question 140. A situational crisis is an unexpected and unplanned event such as the death of a spouse. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Situational crises are caused by external events that are often sudden and unpredictable. Question 141. At what point in the nurse-client relationship should termination first be addressed? Option A, in the working phase. Option B, in the termination phase. Option C, in the orientation phase. Option D, when the client brings it up. The correct answer is option C, in the orientation phase. The parameters and expected end of the relationship should be established during the orientation phase. Question 142. The drug of choice to decrease uric acid levels in gout is: Option A, prednisone. Option B, allopurinol. Option C, indomethacin. Option D, hydrochlorothiazide. The correct answer is option B, allopurinol. Allopurinol is specifically used to inhibit uric acid formation and manage symptoms of gout. Question 143. The Patient Self-Determination Act of 1990 is intended to: Option A, enhance personal control over legal decisions. Option B, encourage medical decision-making prior to need. Option C, give one federal standard for living wills. Option D, emphasize client education. The correct answer is option B, encourage medical decision making prior to need. The Act encourages individuals to make decisions about their medical care and advance directives before a crisis occurs. Question 144. Which nursing intervention best promotes sleep for a 4-year-old child? Option A, turning out the light and closing the door. Option B, tiring the child with play exercises. Option C, identifying and following home bedtime rituals. Option D, encouraging visitation by friends. The correct answer is option C, identifying and following home bedtime rituals. Maintaining familiar bedtime routines and rituals is the most effective way to help a child sleep in a hospital setting. Question 145. Fat emulsions used in total parenteral nutrition have a high energy to fluid volume ratio. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Fat emulsions provide a concentrated source of calories in a small volume of fluid. Question 146. Legal protection of confidentiality extends to both written and verbal information. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Confidentiality covers all forms of identifiable private health information, whether spoken or written. Question 147. Circadian rhythm is the rhythmic repetition of biological patterns every 24 hours. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. The sleep-wake cycle and body temperature fluctuations are primary examples of circadian rhythms. Question 148. When a nurse provides juice to a conscious hypoglycemic client, it is not necessary to add sugar. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. The fruit sugar in the juice itself is sufficient to raise the blood glucose level without causing an excessive spike. Question 149. The purpose of a nasogastric tube immediately following abdominal surgery is to: Option A, simplify medication. Option B, measure accurate input and output. Option C, prevent accumulation of fluids and gas. Option D, facilitate collection of specimens. The correct answer is option C, prevent accumulation of fluids and gas. The tube decompresses the stomach by removing air and secretions to prevent vomiting and surgical site tension. Question 150. Which electrolyte imbalance is most likely to occur in a client taking furosemide and digitalis? Option A, hyperkalemia. Option B, hypernatremia. Option C, hypokalemia. Option D, hypomagnesemia. The correct answer is option C, hypokalemia. Furosemide is a loop diuretic that causes potassium loss, and low potassium can increase the risk of digitalis toxicity. Question 151. A client with a nasogastric tube begins vomiting. What should the nurse do first? Option A, retape the tube. Option B, clamp the tube. Option C, remove the tube. Option D, check the tube placement. The correct answer is option D, check the tube placement. Vomiting may indicate that the tube is displaced and not effectively decompressing the stomach. Question 152. When suctioning a client, what is the usual amount of time for each suction pass? Option A, 2 seconds. Option B, 10 seconds. Option C, 20 seconds. Option D, 30 seconds. The correct answer is option B, 10 seconds. Suctioning should be limited to 10 seconds to prevent hypoxia and trauma to the tracheal tissues. Question 153. A child has a skin rash with maculopapular lesions and honey-colored drainage around the mouth. This indicates: Option A, chickenpox. Option B, non-contagious infection. Option C, impetigo. Option D, allergic reaction. The correct answer is option C, impetigo. Honey-colored crusts and drainage are classic clinical manifestations of impetigo, which is a bacterial skin infection. Question 154. A client with Parkinson's disease has an impairment in executing voluntary movements. This is called option A, akinesia. Option B, dyskinesia. Option C, chorea. Option D, dystonia. The correct answer is option B, dyskinesia. Dyskinesia refers to the difficulty or impairment in performing voluntary muscular movements. Question 155. Toradol is an injectable nonsteroidal anti-inflammatory drug that is comparable to morphine in efficacy for acute pain. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Toradol provides potent analgesia for short-term use in managing moderate to severe pain. Question 156. A client with urinary tract calculi needs to avoid which of the following foods? Option A, lettuce. Option B, cheese. Option C, apples. Option D, broccoli. The correct answer is option B, cheese. Clients with calcium oxalate stone should limit high calcium foods like cheese in their diet. Question 157. Which of the following medications should be held 24 to 48 hours before an electroencephalogram? Option A, furosemide. Option B, diltiazem. Option C, digoxin. Option D, phenytoin. The correct answer is option D, phenytoin. Anticonvulsants like phenytoin must be held because they can suppress the electrical activity being measured by the test. Question 158. A dark red color in a colostomistoma is an abnormal finding that indicates inadequate blood supply. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. A healthy stoma should be pink or rose colored. Dark red or purple indicates ischemia. Question 159. It might take several weeks of medication therapy for a client with Parkinson's disease to see improvement in symptoms. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Clients should be taught that the effects of medications like levodopa are not immediate. Question 160. Which of the following is a symptom of pregnancy-induced hypertension? Option A, headache and blurred vision. Option B, increased energy. Option C, low blood pressure. Option D, increased appetite. The correct answer is option A, headache and blurred vision. Headaches and visual disturbances are serious signs of pregnancy-induced hypertension and preeclampsia. Question 161. The presence of human chorionic gonadotropin in the urine is specifically indicative of pregnancy. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. This hormone is produced during pregnancy and is the basis for most pregnancy tests. Question 162. Which of the following describes the function of the sodium-potassium pump? Option A, active transport. Option B, diffusion. Option C, filtration. Option D, osmosis. The correct answer is option A, active transport. The pump uses energy to move ions against a concentration gradient, which is the definition of active transport. Question 163. Hepatitis A is transmitted via the fecal-oral route while types B and C are blood-borne. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Contaminated food and water are the primary modes of transmission for the hepatitis A virus. Question 164. Which direction given to a nursing assistant is the most effective? Option A, make it a stat delivery. Option B, please do it after break. Option C, the client is delirious. Option D, collect the urine now and take it to the lab immediately. The correct answer is option D. Collect the urine now and take it to the lab immediately. Specific and concise instructions ensure that tasks are prioritized and performed correctly. Question 165. The rule of nines assigns what percentage to each lower extremity for a burn injury? Option A, 36%. Option B, 27%. Option C, 18%. Option D, 9%. The correct answer is option C, 18%. According to the rule of nines, each leg represents 18% of the total body surface area. Question 166. The Moro reflex in a newborn includes hand opening and abducted extremities following a jarring motion. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. The Moro or startle reflex is a normal developmental finding in newborns. Question 167. What is the appropriate ratio of cardiac compressions to ventilations in an adult for one-person cardiopulmonary resuscitation? Option A, 5:1. Option B, 1:5. Option C, 15:2. Option D, 2:15. The correct answer is option C, 15:2. The standard ratio for adult resuscitation is 15 compressions for every 2 breaths. Question 168. A nurse sustains a needle puncture and requires prophylaxis. The initial recommended regimen is: Option A, an antibiotic and a protease inhibitor. Option B, 2 non-nucleoside reverse transcriptase inhibitors. Option C, 1 protease inhibitor. Option D, 2 protease inhibitors. The correct answer is option B, 2 non-nucleoside reverse transcriptase inhibitors. The Centers for Disease Control and Prevention recommends 2 non-nucleoside reverse transcriptase inhibitors for post-exposure prophylaxis. Question 169. Which of the following medications is a muscle relaxant for acute muscle pain and spasms? Option A, mivacron. Option B, atropine. Option C, bethanechol. Option D, Flexeril. The correct answer is option D, Flexeril. Flexeril is commonly prescribed to relieve pain and spasms associated with acute musculoskeletal conditions. Question 170. A client with diabetes insipidus will have lab work showing decreased urine osmolarity and elevated serum osmolarity. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. The lack of antidiuretic hormone leads to large volumes of dilute urine and systemic dehydration. Question 171. A child with Down syndrome has weak muscles and diminished reflexes. What should the nurse do first? Option A, contact the physician immediately. Option B, send the child for X-rays. Option C, start an intravenous line. Option D, position the neck in a neutral posture. The correct answer is option D, position the neck in a neutral posture. These symptoms may indicate an atlantoaxial dislocation and the neck must be stabilized immediately. Question 172. Which of the following is a symptom of cellulitis in an extremity? Option A, cold skin. Option B, red and swollen and warm skin. Option C, blue skin. Option D, itchy skin without swelling. The correct answer is option B, red and swollen and warm skin. Cellulitis is a bacterial infection of the deep skin layers characterized by redness and warmth and swelling and fever. Question 173. The therapeutic range for lithium levels is typically 1.0 to 1.2 milliequivalents per liter. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Levels above this range are considered toxic and require medical intervention. Question 174. The frontal lobe of the brain is responsible for behavior and emotions. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Damage to the frontal lobe often results in significant changes in personality and emotional regulation. Question 175. Which of the following is a live virus vaccine? Option A, varicella. Option B, inactivated polio vaccine. Option C, diphtheria and pertussis. Option D, a hepatitis B. The correct answer is option A, varicella. The varicella vaccine for chickenpox is a live attenuated virus vaccine. Question 176. Procardia is used for the quick relief of severe ischemic chest pain. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. It is a calcium channel blocker that can help dilate coronary arteries and relieve angina. Question 177. An effective way to test cranial nerve 7 is to check taste on the front of the tongue and facial muscle activation. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. The facial nerve controls the muscles of facial expression and carries taste from the anterior tongue. Question 178. Which of the following is the most critical indicator of a neurological disturbance? Option A, short-term memory. Option B, level of consciousness. Option C, Babinski sign. Option D, Clonus sign. The correct answer is option B, level of consciousness. Changes in the level of consciousness are the earliest and most sensitive indicators of neurological status changes. Question 179. High-density lipoprotein cholesterol levels above 60 mg per deciliter are associated with a decreased cardiovascular risk. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. High-density lipoprotein is often called the good cholesterol because it helps remove other forms of cholesterol from the blood. Question 180. Unilateral pupil changes can be a sign of increased intracranial pressure. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. A single dilated or non-reactive pupil can indicate brain herniation and is a medical emergency. Question 181. Atropine is the primary medication used to treat symptomatic bradycardia by increasing conduction through the heart. Option A, true. Option B, false. Option C, not applicable. Option D, not applicable. The correct answer is option A, true. True. Atropine blocks the vagus nerve and increases the heart rate in clients with slow heart rhythms.